I'll get started. Gonna wait a little bit.
Do you guys want to get started on your side or wait a few minutes? It's up to you.
Either way is fine.
Okay.
We usually get a few more, but I'm not sure.
A couple stragglers.
Yeah.
So are there people sitting on the other side of the room that we couldn't see?
Nope, there's
No,
just two of us.
There's normally
Okay.
a few more here, but not now.
Okay.
We see you have cookies.
I know we're jealous. I didn't bring food this time because usually no one eats it.
Great. Well, why don't we go around the room and just introduce ourselves? I'm just kind of curious as to, since it's not like an overwhelming huge number to contend with. Do you mind starting up at State College, introducing yourselves, and then we'll come back down here to Hershey?
Sure, I don't mind at all. So I'm Meg Winchester. I'm the coordinator for the Global Health Network, research associate in health policy, and as you all embarrassingly heard, doing many other things too. And we have two other people on this end.
So I'm Stephen Matthews. I'm professor of sociology and anthropology, and I direct the graduate program in demography, which is a multidisciplinary dual title degree program here. And I won't give you any other titles, but I do a lot of different things.
And we have one other person who's off camera right now.
Should I just?
Yeah.
Okay, I'm Anita. I am a first year PhD student in nutrition science.
Nutrition science, okay.
All right.
Thanks. Do you mind starting over here in the corner? Sure.
I'm Louise Greg. I'm a dietitian here actually, and I work with eating disorders.
Excellent. Thanks for coming.
I'm Leslie Wilmendorf. I am within the College of Nursing as a community health instructor.
I'm Kristen Schneider. I'm in the Department of Public Health Sciences, an assistant professor.
Hello, Stephen. Hi, Wenky Wang here.
Yeah.
Haven't seen you for a while. So I'm associate professor of public health sciences department and director for the Master of Public Health program.
I'm Evie Agbese. I'm a project manager in public health sciences.
I'm Diana Ballat, public health sciences.
Okay. And Joy just joined us. Joy, we're just introducing ourselves if you want to.
I'm Joy. I'm in the Department of Family Community Medicine, Office of Outreach and Research, and I'm a grant writer, project coordinator.
Can you hear okay on your side up at State College?
Yep.
Okay, and someone else just joined you too, if you don't mind.
Yep, that's Allison. Do you want to? Sure, I'm Allison Grenand. I'm in the Department of Nutritional Sciences here, assistant professor.
Okay, great. Okay. Oh, some feedback. Okay, so my name is Ben Fredrick, and I'm a family physician, and I picked up this whole global health thing around 2008 or so. And I'm not going to give you the story or the history of how I got into that, but more jump you forward to this time about some of the things I've learned in doing this and in trying to balance life. I think that's kind of what a lot of this is. Trying to figure out how to balance life responsibilities, work responsibilities, things that you want to do, and how to line that up with doing global health. So that's kind of what I'd like to spend my time doing today. And please, let's keep this kind of informal. So if you have questions or thoughts, feel free to toss them out as we go along. So I've got kind of two parts to this presentation. The first one relates to lessons that I learned primarily in Haiti. And out of my work in Haiti, which was very rural Haiti, and starting to work in Ghana, I started to learn about the importance of lesson number 2, which is alignment. So the first thing I'd like to talk about is perspectives, passions, and purpose. And then after we kind of work through that, I'd like to shift over and talk a little bit more about alignment. So this is kind of a bigger picture presentation related to global health as opposed to a specific topic or a theme, for example. So hopefully that's of interest to you. So I want you to spend just a minute looking at this photo, which is taken in rural Haiti. I took this photo a couple years ago. And I want you to sort of think to yourself, what do you see in this picture? And I'll just give you a minute to think about that.
Dirty water.
Dirty water.
Children playing.
What else?
Not much place to grow any crops.
You're thinking from, yeah, a tough little terrain to grow things.
Looks like the one in the middle there has a water collection bucket.
Okay, kid running with a collection of water. Anything up at State College?
Plus animals,
Animals, yeah.
standing water. Standing water.
Okay, thanks. Good. Well, we'll be revisiting this photo next several slides. So I want to take this picture and look at it from three different angles, if you will. One is the issue of perspective. What do we see when we encounter problems? And what do other people see when they encounter problems? And how do we use their perspectives to help solve the problem and bring a solution about in global health? And then passion. Does this sort of thing, when you look at it, make you passionate in any way, shape, or form? And if it is, what does it do for you or to you, and how do you use that in global health? And the third is purpose, sort of what underlies why you would want to do something in global health in the first place. So this is back to the question of what do you see? And there is no wrong answer to this. It's one of those kinds of things where you get to say whatever you want to say, and it's right. And the purpose of this is really to show that each of us comes at the picture with a slightly different perspective. We all see pretty much the same kinds of things, but we might focus in on different aspects of it right off the bat. Things might catch our eye. And the way our perspective helps to frame the problems that are before us. And our unique perspectives are really important in global health. We need to hear not only our own perspectives and think about them, but listen to other people as well. Global health is really about collaboration. A lot of good work in global health is bringing in other people and their perspectives, their ways of seeing things, their approach to understanding the underlying issues. So the first sort of lesson that I learned is that it's important for me to sort of document and think through what it is that I'm seeing, and learn that through some effort, I can start to see things in new ways. I may not be an engineer. I may not be a computer scientist, a nutritionist, a nurse. I tend to come at it from a physician's perspective, but I can learn those other perspectives. I'm still going to be deficient. I can't learn all of those perspectives at one time. I want to start collaborating with others and asking them, what do you see? How do you see this problem? And how might we work on this together? So when I see it, I saw a lot of the same things you did, right? The stagnant water, which is a breeding ground for disease, malaria and dengue fever, all kinds of parasites brewing in this slop. The soil or the lack thereof, the hard terrain. This is a pretty tough area to imagine. Can you imagine converting this and transforming it into a field, into a fertile field of growing something nutritious? It seems like it's going to be a hard sell. The ground's really hard, it's rocky. So it seems like there are some big challenges. There's a hog in the water. I don't know if you can see that up front here, just hanging out, chilling because it's hot. And animals in the background. And you know what? They're eating and drinking and defecating all over the place. And frankly, so are the humans. Some of the humans, like this little kiddo, has shoes, but some others don't. This kid is carrying water, so it wasn't like they have water piped right into their houses. This is pretty standard for rural Haiti. You carry water from some distance. So you can kind of start to put together some perspective on the health issues that this little village is dealing with. And then you got to wonder, okay, where on the earth do we start? So now take a second to think about what's your emotional response to that scene. Imagine that you're behind the camera, that you're the one taking the photo. So you're standing there, you're smelling it, you're seeing it, you're feeling the heat, you're standing near that hog or whatever it is that sort of disgusts you. And imagine what is the feeling that this generates for you. And I'd be interested in some of your responses to that. And again, no wrong answer.
For me, it's inviting that I want to join in with them, help them carry the water, or it looks like to me, it looks like they were playing. If they're running or playing some game that could be interesting.
Mm-hmm. Okay.
To me, that to address the human health issues there, there's a whole host of issues need to be addressed.
So you feel overwhelmed?
I feel overwhelmed. I mean that these people need water.
Yep.
And that's not an easy thing here. And they need crop. They need some basic agriculture, even animals farm. And that are not easy as well. So there's a whole host of issues that before even we can actually talk about healthcare.
Before getting to healthcare, yeah. Others, what are your perspectives? Anything you
I'm
focus
actually
in on or narrow in on? Go ahead, Stephen.
I was actually wondering how many of us have actually taken very similar photographs.
Uh-huh.
So I've done work in Nepal, and one of my favorite photographs in Nepal was one of the first I took. And it's very similar in the sense that it was a drainage canal that was very low water level, but clearly muddy as all hell. There were animals in it, and there were about 10 kids playing some kind of game. And I was shocked at two things. One, I was shocked at the health challenges that it seemed to represent, but I was actually shocked at how happy everybody was.
Yeah,
and so
right.
I came into a situation where you're there in theory to, it was more of a demographic study than a health study, but it was one of those things where the preconceptions of poverty and happiness, they don't go together linearly very easily. And so it was a challenge to try and come in from the outside saying, you've got a problem, when in fact, everybody seemed to be quite comfortable with their lot until we told them they were poor.
Right.
So it's another ethical dilemma that you're telling them they're poor because from your standard they are, but they're actually having a lot of fun and doing very well. And perhaps the most serious health problem wasn't the one I was looking at in the photograph.
Uh-huh. Good. Other perspectives, other feelings.
Tell us a little bit what that was my view too, is thinking about the conflict of what I'm seeing is probably not what they're seeing. That perspective of they probably feel fine with where they live and how they're living, whereas we could identify the health issues that are related to that.
And I'm thinking also, how do they develop and thrive in such environment, while maybe some of us would get sick, but they don't, so they probably have some kind of resistance to the environment, and why fixing for them what's really not broken for them.
Okay, so you can come away from a scene like this with a feeling, with a sense of, well, you can be disgusted, in which case I'd say probably, maybe that's not the project for you, or the effort, or the initiative. Like if you're really like revolted and like I could never step back there again, don't pour all your energy into that kind of initiative. If you come away and you have some sense of, these are wonderful people, I love working with these people, I love their happiness and their joy that they're exuding, but their kids are dying young, and they're dying from preventable things like diarrhea and pneumonia and malnutrition, and I see it wherever I go. Well, gee whiz, I'd like to be part of that solution. I'll show you how I use it, but I see that passion, that sort of emotional feeling that you get, that strong sense of excitement about of doing something. You can use the passion to keep you going along the way in the global health work. And I think passion is pretty important in global health work. But you got to keep in mind a couple things. One is it's not endless. Passion's important, but it runs out. It's like fuel. And you've got to have, it's just a marathon approach, not a sprint. You can kind of draw on your passion every now and then to re-engage you at some level in doing this work and help you stay on course and on focus. When you get to that point of why bother? This is so hard. This work is so difficult. The passion can help drive you back to your purpose again. And so then finally, purpose. So what might you hope to achieve or accomplish or engage in a place like this? What drives you? And I don't think we have to sit and answer this one as much as it's a personal question for you. What drives you? What's meaningful work in your minds? What gets you up in the morning? Only you can answer that, because it comes from your background and your skill set, your expertise, the interests that you have, the value sets that you come to the table with. So no one can answer that but you. But I think it's very important to, at some level, keep reflecting on that. Why am I doing this work? It answers the why question. Why do this? What's so important about it? And the purpose is really sort of the long view. That keeps you on course in terms of why am I doing what I'm doing. So I like this quote. It's from a guy named Jonah Lehrer, who wrote a book, Imagine How Creativity Works. I really enjoyed this book a lot. Every creative journey begins with a problem, like what we're seeing in this picture. Starts with a feeling of frustration, the dull ache of not being able to find the answer. It's a struggle that forces us to try something new. And that's what's needed in these kinds of places, is that creativity, that using our imagination to, and then using our skills and energy to create something new. I want to show you a couple examples from Haiti that I worked on that I think try to tie these together. So this is a couple of photos from Haiti related to water. And so I've got at the top, perspective shows us the possible problems as well as the solutions. Passion provides a boost of fuel to allow us to persist in finding the solutions, kind of keep pursuing them. And purpose provides a longer range goal. So in terms of, how I would think through this issue, as a physician, the number 2 cause of child death in a place like rural Haiti, the picture you just saw, is diarrhea, which is absolutely preventable. It's not because it's difficult to solve from a technological or technical standpoint. We know how to fix this. We know how to substantially reduce child death, but actually getting it done is a lot harder for all the reasons you just saw in that picture and in some of these pictures, the water quality issues, the lack of water availability. So from a physician's standpoint, I see children dying of diarrhea and know this is preventable. And from a public health perspective, sort of broadening it out, they lack access to clean, safe water. So the passion, when I encounter this, I'm personally motivated by some of the passions of feeling great sadness about what I'm seeing or hearing, what I'm knowledgeable of, anger, frustration, and resolve. There's some level of resolve that I can kind of always pull back to. We will fix this. We'll find a way to solve or reduce this problem. And the purpose, which is not fully showing up for some reason on the bottom, the purpose is to reduce child death in this related to unsafe water. For me is a great goal. It's a purpose. It's what would get me up and say, we are going to make a difference in the lives of these kids, in their families, in their communities through this. That's my ultimate goal. That's my purpose. And it's driven by my value set, by the fact that I can't leave these can't get these kids out of my head, by my faith, the whole host of things. Again, your answers will be different. So we engaged on a number of levels to try to solve this, and it's taking multiple attempts in different ways. We mapped out all of the villages in the community. So there were about 230 different villages that we found in GPS coordinates, including the island. By the way, that picture was taken, I think, out here on the island, which is the poorest of the poor for this whole region, which is quite poor to begin with. We tried water filtration systems for those people who do have access to water, like that pond that you saw that was murky brown. That little pond is called the Fever, because that's what it generates a lot of, fever. And it's just teeming with bugs. But you can clean that water up. They drink that all the time anyway, because that's all they have. And this is such a water deprived area. So water filtrations like this ceramic water filter, this is made in Haiti. It's impregnated with silver. And so when the water passes through and the microbes kills the bad stuff, and the water goes down through and ends up in this bucket. Can you guys see my cursor up there, or am I just doing it for our community here?
Yes.
Yeah.
No.
Okay, good. And then there's a spigot, which you can't see on this, but a spigot at the bottom. The water drains down, and and then it keeps the water safe in the bucket. And there are all kinds of different solutions like this. We have to figure out how to get them out to a place like this, and frankly, in kind of a sustainable manner, but I don't have time to talk about that. But one issue is water quality. Another question is water quantity, which is what this tries to solve, and this tries to solve. So these are containers with PVC piping. You hook it up onto roofs. It collects the water collects the rainwater, and it stores it there as they need it. And especially in a water deprived or very water poor area, these are the sorts of solutions that make a lot of sense. One of the nice things about this is that they're easy to haul when they're not full. You can haul them way out into the distant villages, which are off in the mountains, and you can't even drive there by motorcycle. We attempted a well drilling project, which would have been truly life-saving and transforming for the region, because this is such a water poor area. These large triangles represent where the candidate sites were that we mapped out based on a number of criteria. Again, I didn't drive the rig, right? And I didn't actually generate the money myself to do this project. I had to bring in other people who could do this kind of work. And I had a great organization of water engineers who helped me with this, connected us up with a well driller, had funders working with us, a whole host of people. And that's the collaborative approach that's necessary in global health. Another example in Haiti, this is actually my first trip to Haiti back in 2007, and I did a sort of walked around to a variety of villages and held these little town village hall meetings, asking them what were some of their major concerns. This is, I mean, I was completely naive. Actually, my first trip out of the country was that trip, period, ever. I had to get a passport for that trip. I never had a passport before. So I'm not this like well-traveled individual who has tremendously, years of experience in global health. That's where it started. And one of the surprising things I heard in those meetings was that the parents were saying that their kids couldn't see well and that some of them were going blind. And I said, well, why is that? And they said, we don't know. You're the doctor. You tell us. So I had to come back because I had no idea. I had no idea that didn't make any sense to me. And one of probably the most likely cause was vitamin A deficiency, which is a big, big problem in this area, in a rural area like rural Haiti. So when I started looking into it, I was shocked to find out how vitamin A deficiency causes tremendous amounts of morbidity. It contributes substantially to mortality. And when you treat vitamin A deficiency in a place like this is a kid, by the way, who has severe to moderate malnutrition. You can tell by this upper arm band, mid-upper arm circumference band. It's easy to read. Green's normal, yellow's mild malnutrition, orange is moderate, and red is severe malnutrition. Easy to use in the field, can quickly do a sample and find out what the status is on malnutrition for kids in the area. So anyway, an area like this has a lot of malnutrition, and vitamin A supplementation in this area can reduce all-cause child death by maybe 20%, depending on the area. So that's a pretty substantial savings of life. And we were able to start up child health campaigns at $4 per kid per year, which is really, really cheap to save hundreds of kids' lives. So I learned that this is a preventable issue. It's a highly cost-effective. I just have to remember this kid. That's what keeps me going. Every time I get frustrated, I remember who I'm trying to help and serve. And the purpose or the goal, we want to get rid of this problem. And if we cover every kid who's eligible with vitamin A supplementation, we can eliminate vitamin A deficiency from this region. And I mean every kid. And that's what we attempted to do. And so every child health campaign, the workers, these are the workers. So I went down, I trained these workers, there are about 20 of them total, to give out the vitamin A capsules, which we got for free from an organization called Vitamin Angels. And they gave us a lot of the supplies. These were training sessions I held with the workers. And these were just individuals who graduated from high school and could read and write and were honest. Those were our criteria. They were trained to do that stuff. They went out twice a year, and twice a year they would reach 10,000 kids throughout this region with vitamin A capsules. And that was pretty close to, I'm not sure the coverage rate, but it was close to 100% because, like I said, there were 230 villages, but the government only knew of 130 villages. And we went through and mapped all of the ones we found, and they just went deep, deep into the mountains and found the villages and did a fantastic job of finding these kids and making sure they got the vitamin A. So when you get 100% coverage rate, then you can really demonstrate potentially over time improvements in health. A couple of notes about the vitamin A initiative. Parents loved it. Well, we paired the vitamin A capsules with deworming pills, which is brilliant, and I didn't know that at the time. But the reason it's brilliant is that when you give the kid the vitamin A and the deworming pill, the kids poop out worms. And then the parents are like, oh my word, this stuff is awesome. It's effective, One mom counted up 106 worms, and she was just thrilled, right? Because they know this is doing something good for their kid. So you get some buy-in through kind of pairing it in that way. We built this human network. So these workers were represented the different areas in the region, and literally they became a network for us. And we used the network for other purposes. We layered on top of that network vaccinations. So we started doing vaccinations throughout the whole region for the first time. Though there's one Haitian physician in that area, and he would see a case of tetanus per week. So that's pretty dramatic. So getting tetanus immunizations out there in the community can eliminate that problem, and people will die of tetanus. Employment. So this photo is actually kind of a fun one for me. This is one of our workers with his wife and little kid. He built the house with the funding that we gave him for his work, which is really cool. So it has these sort of ongoing benefits in the community, in the villages. I mentioned already this sort of stuff. I estimated, this is a low estimate, I think, 100 kids per year not dying because of the vitamin A, which is pretty awesome. There's nothing I do in the United States as a physician that gets that kind of health outcome. That's just all the way there is to it, which is pretty humbling as a physician who likes to imagine that we're the pinnacle of providing health care. In actuality, this is pretty amazing. And if we, the water issue is another one. Oh, and this is kind of cool. So Haiti gets a lot of hurricanes, right? It just always goes through that area. So when we see hurricanes popping up on the weather screen that's heading toward Haiti, I can send a message down to the physician who sends it out through the network and helps to prepare people. And before that, they had, of course, no clue until it hit them. So, whether it helps or not, I have no idea, but it doesn't hurt, and it's an extra bonus. Like I said, it costs $40,000 per year to cover the entire region. We have 10,000 kids twice a year. It's pretty cool, huh? So the lesson number one is to sort of link these things together. Your perspectives, what you're seeing, bring other people into bring their perspectives in to the problem. Passions, the same thing. Find out what your passions are and what other people's passions are. What drains you, try to avoid, and what drains them, try to avoid for them. And build off of their passions, build off of what makes it work for them. And purpose. That's what links it all together, in my opinion. What is it we're going for? So that's Haiti. Now I want to move on to Ghana because Haiti burned me out. So now moving on to Ghana, the second lesson is about alignment. And this is kind of a picture that I think is helpful to imagine. When things are balanced right, everything lines up right, you can make it work. And if something's a little bit off, it can fall apart quickly. I kind of learned that lesson through Haiti. So now imagine just one of these little balls that's Haiti for me, right? And I'm balancing Haiti in the midst of the rest of my life. One of these other balls, maybe one of these big ones down here, is my family life. Well, another one's my work life, other volunteer. You can put in whatever areas you want to these things. In this case, this was where my global health energy was going and where I wanted to focus it. So let me describe some misalignments. We're talking about alignment now and misalignments. So what happens with misalignments is they can be awfully painful and take a lot of energy to bring into alignment. A lot of energy, and a lot of your time and valuable energy can be, I don't want to say wasted because it's not wasted, but it can be consumed by trying to straighten out misalignments. So you feel it as, this is so hard. I'm putting in so much energy and I'm not getting anything out of it in return. It feels like people are pushing against you in different places. When you start to feel that kind of pushback, you feel like you're getting derailed, then realize maybe there's a misalignment going on here, either between your expectations, their expectations. Somewhere there's a misalignment, either in your life, your work, their work. So this is what I had in mind. In 2008, soon after I came back from Haiti, I came up with this concept of a global health scholars program here at the medical school. We didn't have anything formal in medical school here for global health, period. Nothing existed. So I thought, well, I came up with this idea of a scholars program, and we'd bring medical students down to Haiti, and they'd work with me in this rural area, and I'd use their energy and their passion and their skills to help improve the health of the community. And through that, we'd promote the work of vitamin A, water, nutrition, other topics. And the students would learn, and there'd be a preclinical component as well as a clinical component to the medical school work. That's how it started. How it actually went, though, it didn't go that way for a variety of reasons. To this day, the Global Health Scholars Program is quite an exciting and robust program here on our campus. We now have 20% of our first-year medical students involved in the program, which is 1 out of every 5 medical students here. And we have Masters in Public Health students for the first time this year. But it's not in Haiti. It's in 5 other countries, but it's not in Haiti. And it's not going to be in Haiti. And what ended up happening over time is a divergence and a splitting of my energies. A lot of energy going still to Haiti, and I found that I had to form an organization in order to handle the incoming donations and all the good stuff that we were trying to do. So we started up an organization called Thriving Villages International. And so that's essentially kind of running a business, it turns out. It's a nonprofit, but it's got all, I mean, you're taking care of taxes, you're doing donations, you've got reporting, all kinds of stuff. So we continued that work on. And while I was building out the Global Health Scholars Program at the same time, and found out it wasn't going to Haiti, but we ended up moving it to another country in Ecuador to get it going, always with the thought that we would return to Haiti. So this was my employment. Imagine that as one of the balls, if you will. And then this was another ball over here. And I was putting a lot of my passion energy into these two very similar purposes, but they were splitting me in half, right? There was becoming a misalignment between the two main areas of global health that I have as my passion and my interests. And that overall is really a setup for failure over time. So big lesson learned here is when you can link up your global health passions with your employment, or line them up with other aspects of your life in order to keep being able to keep doing it. Or what you have to do in my case is I focus most of my energies now on this and very little of my energy on this. That's just a natural consequence of what I've had to do. Oops, that's duplicate, just in case you didn't get the point. So yeah, this was a big misalignment for me. I used up a lot of energy, became a lot of friction, a lot of tension. I wore down several times, and that's a really tough place to go. So Ghana, let me shift gears to Ghana now briefly. And we've been able to expand the Global Health Scholars Program to Ghana. So we have we're working on micronutrient deficiencies there. I've been able to leverage my learnings from Haiti and apply them now to rural Ghana, where they have similar problems. And we have the student education component going on, a trip at the end of medical students' first year and MPH students' first year, and a return trip in their fourth year to the same location. So this is part of my employment, and now this is part of my employment. That's starting to line up well. A little bit more about Ghana. Ghana's been really, really exciting for me. So not only the educational piece, but our medical school here is involved with a new medical school starting up in Ghana toward the end of this year, called Mount Crest University. This is the groundbreaking ceremony I was at last year, and these are the founders, Kweku Ansah Asari and his wife Helena. And this is a really exciting venture that not only have I been personally involved in, but our medical school has been becoming more and more involved in and is partnering with this medical school. From the perspective of Ghana, let me kind of go through. The healthcare needs in Ghana are great, so there's a compelling call, if you will, to get involved. We have a great partner in Mount Crest University who is wonderful to work with. They're starting up a new medical school in rural Ghana. It's the first medical school in the rural parts of Ghana. It'll be a private medical school. And we saw a lot of potential for collaboration beyond medical education. Personally, I'm energized by the passion and the vision of the founder and the people who are involved in their energy. The opportunity to make a big difference again in a rural setting, which is part of my passion. And the purpose is really to collaborate with this new medical school in order to improve the health of the surrounding community, not only to generate more health professionals for a country that needs health professionals, but to make a difference in the community in which this medical school is situated. Is it working? Is it aligning well? I'd say yes. This has gone really, really well. In the past year alone, we've had not only an MOU, a Memorandum of Understanding signed, but also a funding agreement between our campuses. We've hosted faculty on campus from Mount Crest University. One was here for 6 months and was trained in our simulation center. She's going back to run a simulation center once it's built. Joy, who's sitting over here to my right, is helping us to write a grant, a $2 million grant to help them build a simulation center. And we'll be submitting that soon. So we have a nice connectivity right now between our simulation center and their future simulation center. We had a clinical team go over just last month in February, about 10 to 15 individuals, You can see some of the one of the photos, or two of the photos from that, where our students and our faculty, nurse practitioner students, medical students, provided care in the clinical setting. And we've generated a whole host of opportunities that we can potentially work on in the clinical realm as well now. Quality improvement type activities, infectious disease related activities, trying to reduce the burden of antimicrobial resistance to, you name it. I mean, there's just no end to potential areas for involvement for our campus. You see, now it's not just the medical school, now it starts to broaden into other campus activities. We can invite others in to become participants in our collaboration. We had, this is one of our fourth year global health scholars. She went in the first year and she returned this year as a fourth year student. So that was exciting. We sent over 3 shipping containers worth of materials, largely textbooks and journals, because they need to have a print library. That's one of the requirements for accreditation. We held a conference in Ghana last month where several of our faculty and several of Mount Crest faculty did presentations over a couple of days for the clinicians at the Eastern Regional Hospital. We'll be hosting 4 more of their faculty next month for a month-long certificate program here on campus, helping them with best medical educational practices, and so forth. My point in saying all of this is there's a lot that's happened in just the last year, a lot of enthusiasm on campus. People are getting involved. I'm absolutely thrilled. And it's part of my work. So when I go over to Ghana now, this is on work time. When I went to Haiti, it was always vacation time. Always vacation time. And sometimes I would go 4 or 5 times a year. You know, sometimes quick trips, and that kind of ruins all your vacation time. So alignment, right? And the other thing is in September, I was able to take my wife and kids over to Ghana. We had a phenomenal time. That was their first experience in a country like that. And they got to see a little bit of what I'm involved in, and had a fantastic experience, and it's been a joy. And so family is another one of those elements of how do you build that into make sure this all sort of how it works with your alignment of your life. That's not going to burn you out. So some of the lessons learned, global health work I find is hard, but it's really rewarding and exciting. I hope you can kind of detect that in my excitement describing it. So the first thing is develop multiple perspectives, both for yourself. Learn to look from whatever perspective you tend to come from, and then broaden your perspective. You know, develop that cognitive flexibility to approach a problem from multiple perspectives, and go out and find others who can also look at the same problem from their unique perspectives to give you a better chance of solving or finding the problem. Collaborate. Pursue your passions and learn others' passions. Fit them into, if you're coordinating, you know, find a place for them within the overall structure so that it lines up with their passions. Otherwise, it's going to drain them out, especially as volunteers, and they're going to want to walk away and say, I'll find something else that fits better. Reflect on your purpose. What gives your life meaning? What gets you up in the morning? Why do this kind of stuff? It's worth thinking that through every now and then as a course corrector for yourself. Am I on course or not with the kinds of things that most meaningful for me? And then finally, seek alignment. Those other 3 things, you know, they don't stand on their own anymore. They have to be lined up within the rest of your life and align with the priorities of other people, other organizations, and what they're doing. That's what I have. This is another beautiful photo from Haiti. Not fantastic? So Haiti's a fascinating place of incredible beauty, right alongside incredible poverty and sadness. It's really hard to keep in your head at the same time. But anyway, I'd like to hear a little bit about your experiences or questions or comments that you have from what you've heard.
So why couldn't you take the students to Haiti?
Largely institutional, Penn State institutional level. You had the concern of bringing students to Haiti. So Haiti is, I mean, I guess I've worked there enough to know. I've had a number of things go badly, even for myself or people that I've taken. And Haiti does not have the capacity to be able to handle problems well, whether it's violence, whether it's injuries, illness. A couple of years ago, one of my funders went down to Haiti, and even before I was able to meet up with her, she was standing on a second floor balcony meeting with a bunch of kids at an orphanage, and the thing collapsed. Down she went, 30-something kids went down, her camera crew, herself, everything went down. And so I met up with them, and we went to one of the nearby hospitals. They wouldn't take her. She was in excruciating pain in her hip. We didn't know exactly what was wrong, but I was really nervous. And took her to one of the nearby hospitals. They wouldn't see her without cash up front. And then we took her to another hospital, which is one of the best hospitals, and I put that in quotes. And that really struck home to me how the situation in Haiti for healthcare, one of the best hospitals, and that was pretty rough location. They ended up doing an x-ray and finding out she had a hip fracture, and fortunately decided not to do surgery there, because I probably would not have let that happen anyway, but flying her out so that she had to be medically evacuated out of country, and that's tens of thousands of dollars potentially for that kind of expense. And that was right in front of me. That happens. And that was in Port-au-Prince. Now imagine this was out in the rural area where it's a good 8-hour brutal drive from Port-au-Prince, and that had happened. Really, I don't know how that we would have had to get a helicopter to get flown out there. So anyway, I get it. I used to be really disappointed that I couldn't bring students to Haiti. There's wisdom in it.
So one of
I
the
have a
things that
question.
fascinates me is that.
Do you want to?
Yep. So one of the things that fascinates me is that there's so much that we can do on the global health front. There are so many countries that are similar or not similar to the countries that you're describing, and so how do we pick and choose? I know that we have limited energy, that we have limited time, even with alignment, passions, and employment, and so on. That's perfect description, by the way. But how do we pick and choose? How do you make that decision?
I'll tell you what I've learned, and then see what other people think as well. Did you guys hear the question up at State College okay?
Mm-hmm.
Yeah. So the hat I wear is a Penn State Hershey hat. And since that's who employs me, and that's, I sort of am accountable to them, the entity, but I know who I'm accountable to, my bosses. I want to make sure that the limited resources that we have available for global health are pointed in directions that, one, we're not going to be spreading ourselves too thin, so we have to be very careful about what we select and how we select it, and that give us the most opportunity to develop along our missions. So we know what our missions are in patient care and service and research and education. That's what we do here as an academic health institute. And whatever business you're in or whatever company you're involved in, organization, you'll have your own mission statement, your own mission. So you want to make sure you line up with that. And you want to look for those. In my opinion, what I've been looking for with our sites are, what are the sites that allow my institution to become involved along as many of those missions as possible. Some that does, and I can figure that out through discussion pretty quickly, whether there's opportunity to expand in research. So Ghana is a good example. I love Ghana because the barriers for engaging are fairly low. It's English speaking. We have great in-country partners, and the opportunities with Mount Crest University is not just the medical education piece, it's the public health piece, it's the developing of grant mechanisms and finding grants to be able to support the work we want to do together. It's the clinical work, it's getting out into the field and helping the clinicians. It's all of that together. It meets all of our academic health center priorities and missions. There we have other sites we're involved in where the focus is too narrow. It's on a kind of pediatric population, for example. And unless you're a pediatrician who has particular interests or skill set or something that kind of fits around that, it's hard to imagine it being invitational beyond a fairly narrow spectrum or slice. It's not that you can't do those sorts of things, but you have to be very careful about moving into those places because you have limited resources. So so anyway, strategic alignment, I guess, is how I'd put it, that you want to take your limited resources and focus them on the ones that are going to give you the most bang for your buck if you're working at an institutional level. Meg, you're going to say something?
I'm still not quite sure how to frame my question. So I'm an anthropologist, not a practitioner. So I think I come at some of these things from a bit of a different angle. But my question is more about the epistemological underpinnings of doing global health work. Because we teach students here that global health isn't just out there. So I'm thinking how to incorporate a broad global perspective in anyone's work. I mean, how do we encourage like truly reciprocal collaborations, or think about the work in Ghana or Haiti in relationship to healthcare in the U.S.? You know, how do we bridge those connections? Does that make sense?
Oh yeah, yeah. Everybody's nodding. I think you've hit a great nerve. I'll take a first stab at it. How's that? You know, when I went to medical school, I had a number of friends who were geared toward the missions field, you know, going out and doing this kind of global health work. I was never one of those people. I was always going to stay here in the United States, see my patients in my office. That was my outlook and my anticipation. I had no idea I was going to do this. It was through the global health work that my sort of brain exploded. And now I can more clearly see the issues that are sort of right in front of me, have always been right in front of me in my patient care, but I would have had a hard time seeing unless I had been taken out of this context, the domestic context, in which I'm just so steeped, right? And moved into a whole new area and gone, oh my word, this is how they do healthcare. In Taiwan, they do it in a phenomenally wonderful way. In Ghana, they do it in a really unique way compared to the United States. And so you start to broaden your perspective and understanding. And then you come back here and you realize it doesn't have to be like this. This is the structure. This is what we work in. But we can use others' ideas and bring them back here and innovate. I think that the international perspective, especially for learners, especially young learners, but even older learners like myself, is that it takes you out of both your comfort zone and it takes you out of your paradigm, whatever paradigm you're used to working in, and it's really set, and it kind of blows that apart, helps to blow that apart so that you're forced to figure out how to put it back together again and see what it is you're truly working in and where the leverage points are. That being said, you know, if someone were to do domestic global health, right? Like let's say I was doing global health in nearby Harrisburg, I could see that working out really well and aligning really, really well with the rest of my life. I mean, you know, because then you don't have the travel, you don't have the expense, you don't have the time difference, and so forth. You could invest a lot more of yourself, if you will, in your own backyard, and you could constantly get that passion refed as you keep revisiting it regularly. So I don't see them as separate, but I see that they serve different purposes. The experiences serve different purposes depending maybe on where the learner starts. But what do other people think?
I had a slightly different question.
Please.
You go ahead.
I think you did a great job. I mean, I think that having these opportunities for domestic global health like Harrisburg or other local areas can still serve the same purpose in a lot of ways, where they can see a population very different than ones they may see in their typical routine, and offers them opportunities to work with people that are working in those same unique populations. So different kinds of collaboration and ways that somebody would work, broadening that skill set would be important and can be done locally too. So I was just gonna do that.
This is Dana. I was just going to also add, at least with the Global Health Minor program, one of the things that we've seen is when students have gone over, in our case, Tanzania, Senegal, and South Africa, sometimes it shifts their perspectives from, maybe PA school or strictly clinical track to really seeing public health issues differently and coming back to the US and thinking more of a public health career domestically. And so I think that there are ways that that integration is going on, that sort of what your own narrative was. You know, you did it the other way in terms of being domestic and going international. I've seen and heard the other way, which is going international in their undergraduate years, and then really seeing like, I want that experience to inform my domestic practice or my domestic career in terms of moving from clinical to public health.
That's great. That's perfect. Yeah.
So one of my curiosity is that we are under the big tent of Penn State University. And what I found in the past 5 or 6 years when we were together on the corporate health front is that I feel that it's actually quite difficult to engage in global health for the graduate program, because there are two things that I heard pretty often in my interaction with our State College international office. Number one, you guys are in College of Medicine, so it's hard for us to do anything for you guys. Two, that most of our program are undergrad focus. So is that something consistent to you guys experience, or I'm just hearing only in a very skewed kind of a statement?
Well, I direct the largest social science dual degree program on campus, and half of our students do international research. I don't know if that's answering your question. I mean, there's certainly people who do field work internationally. I was going to say that some of the challenges that I face and we face, it's even true. My wife told me last night that she'd been assigned to do a graduate class at 8 o'clock in the morning and till 11 o'clock. And it gets in our way because we have 2 kids who have to be on a school bus, but it also gets in the way of the graduate students who have family. And so now we have a situation where our schedule has been changed so that we do very early morning graduate classes. And when we looked at the schedule last night, we found out that one of the required courses was taught between 6 o'clock and 9 o'clock in the evening, which means that if you're a graduate student with a child, you have to have babysitting, not just for 1 week, but for 15 weeks. And so there's lots of other challenges. I really appreciate your focus on work and family, because I think that's huge in terms of the balance and alignment issue you're talking about. My question to you was going to be about whether or not over your own life, we saw your kids in Ghana, but they were there as looked like teenagers, and they hadn't been there before. And I wondered how much your international work had changed over their lifetime, because I have 2 kids, and I know I didn't travel for about 5 years. I mean, I traveled, but I didn't travel for very long, and I didn't travel internationally very much. So I actually have to go. I have to meet an incoming HPA student who is an international student. And I suspect that, so again, we bring in international students who bring perspectives and diversity of experiences to our program. And they're a valuable way of informing others who are domestic trained and focused. And I think there are a lot of opportunities that Wenky's question alludes to, and what you've been talking about for the past hour. So I certainly appreciate that. I think there's a lot of opportunity. It's just the time. The time factor is the problem. But I do have to go. I'm very sorry.
Well, thank you for coming. I appreciate that, and your comments too.
I'll probably email you.
Okay. Yeah, I love that. Thanks. I think my story is a cautionary tale. Maybe that's why I presented it as I did. So in 2012 or 13, I went through burnout, which is not that long ago. And that was right in the midst of all of this good stuff that was spinning up. And when I mean burnout, I mean, I was almost out of commission for 3, 4, 5 months. Burnout sort of, it came and hit me really hard so that my mind went blank. And I can tell you all about burnout if you want to know. My mind went blank, which as a physician is a very bad thing to have happen. You need your mind, right? I mean, we all need our minds, but you know what I mean? If you're doing this kind of work, and it gradually came back again, but it took months to come back. In the energy level, took months to come back. That's when I realized I can't keep doing it this way. That's what I meant by misalignment in the most significant personal way. You don't ever want to get to that point. And I thought I had corrected it, put all these sorts of correctives in place, barriers in place. The next year, almost that same time, started feeling the same symptoms coming back again. Headaches, nausea when I'd look at emails, certain signs that I'd never had before until I got to the burnout stage. And I realized, oh my word, I'm heading back into it again. So I didn't do well on the work life, family life balance thing. Clearly, I used a lot of passion and pushed my passion helped to keep driving me on and on and on, but without making sure it was well restrained and within its proper constraints. You've got family life, you've got work life, you've got these other things you've got to make sure you attend to. It's easier to do the work when it aligns well with everything else. When there's a big misalignment, you can put a lot of energy into different categories. Bringing those together can really, really help, and you can get the same kind of output, if you will, with not nearly as much effort put in, which is kind of a key goal. So now I've cut way back on my travel abroad. I'm much more restricted in that. Go a couple times a year. Taking my kids with me was a thrill and a joy, and doing family vacations together in a real way has been a thrill and a joy. It's something that was missing for about 5 or 6 years. So I'm a cautionary tale on all of that. I'm not the one to look to on how to do it right. I'm the one to look to on how to do it wrong. But I think I've got a much better work-life balance at this point as a result.
I think that Ben's comment on that really provides us a pretty good perspective and lesson learned. And I think that's, I'm not sure what everyone else is in the room, but myself, for example, that we'll go through that kind of a stage that now when you put your passions and work into a very singular focus and which is misaligned, we won't go too far on that. We go through that kind of a stage, and I'm still in the middle of that. The best time for me to address all my email is after 10 p.m. and that's never a good thing. And we have done that for a very long time, and I don't think that's healthy, and I don't think that it's well balanced, and I think that is something that we all need to think hard, and that's why I think it's very important for us to think about a very strategic way, what is our purpose and what's our passion, and we align them with our work life and with our family, and we can do everything, but we do something that is that's well done. And I think that, I'm glad to hear your story, and I think that it's a very educational and that's very enlightening, and I learned a lot.
Thanks, Marky. I think it comes back to that original picture with the kids and the hog and the that whole mess, right? You can't take on everything and solve everything, and that's okay. That's okay. Find what you can contribute to, though, and keep it in balance for the rest of your life. Make sure it's part of your meaningful work. That'll keep you going. But don't feel like you have to solve the whole problem. Find that thing that you're good at and focus in on that, and bring others and get them involved as well.
Thanks.
Well, thank you all. Thanks all for listening in and contributing. Appreciate it.
Thank you. Thank you very much for coming.
Oh, this is fantastic. Wonderful.
Good. Thank you, Gwen.
Thanks, everyone.
Thanks up at State
Coming.
College.
College.